Hello and welcome to Newsmax Health. I'm John Bachman. Joining us right now from New York City is Dr. Jordan Metzl. And everybody wants to lose weight and feel better and live longer, and people have spent decades waiting for a miracle pill to do just that. But what if that drug already existed? Dr. Jordan Metzl is joining us right now from our studio in New York City. It's good to have you with us.
Nice to be here. Thanks.
All right, well, Dr. Metzl has also just written a fascinating new book called The Exercise Cure, a doctor's no-pill prescription for better health and longer life. Now, Dr. Metzl, you say that exercise is the world's best preventative medicine. Can you tell us what's the latest science that says exercise can fight disease?
That's a great question to start with. I mean, I think the easiest way to think about this is kind of a fictitious doctor's appointment visit, which is the way I start the book. So imagine if you walked into your doctor's office and you sat down and your doc said, hey, listen, I have a drug, and if you take this drug, you will live a longer, healthier, happier life. Not only that, but many of the diseases that you will encounter potentially over the course of your life. Heart disease, which is the #1 killer in the world, diabetes, potentially dementia, going down the body, certain types of cancer, arthritis, osteoporosis, really right down the body, sexual dysfunction, sleep problems. Any number of these different problems could be treated and in some cases prevented outright. You'd pay attention. And then if your doc said, all right, I have that medicine and it's free, you don't have to give a copay, all you have to do is take this medicine every single day of your life, and you would definitely pay attention. You may not believe him or her, but you would pay attention. But we have this drug now, and it's called exercise, and the goal of my book and message is to get everybody in America off their couches and off their rear ends and moving every single day of 2014.
Now, a lot of people, of course, hate to exercise, or they feel like they're just simply too old, or maybe have old injuries that are preventing them from exercising. What do you tell those folks? Well,
so what I do in the book is the first half I talk about kind of the medicine of exercise across the spectrum of the human body, starting with the brain and ending with the feet, and talking about how you can use exercise for all different kinds of medical problems. In the second part, I go through specific workouts for people who are just starting or don't do anything, all the way to people who are pretty advanced. So for the beginning level people, we call them our bronze group. In our bronze group, I want them to start by thinking about becoming NEAT. Now, what does NEAT mean? NEAT stands for non-exercise active thermogenesis, or just starting to burn calories through everyday activities. Maybe if you're someplace without a subway system like New York, parking your car a little further away from where you're going, or trying to build in different types of walking, or walking further, different kinds of activities throughout the day. If you just increase your NEAT profile a little bit, you can reduce many of the common chronic diseases that we see. The American Heart Association recommends 150 minutes of exercise a week, which is about 30 minutes a day. And if you can do that, all the benefits of exercise, all the things I talked about at the top of this interview, will kick in for you. So it's so important to try and start moving, even if you don't feel like you can. Just move a little bit. It'll make a huge difference in your health.
Yeah, that's some great advice. People can park a little bit farther away from the grocery store or the store, or the drugstore, whatever, if they're doing some shopping, and just a little bit can help. But can you give us some more specific examples of exercises? If somebody wants to take the next step, aside from just parking further away from the grocery store, what are some of the next steps people can do if they do want to get involved in exercise, but there's still a little concern about what it might do to their body?
Sure, that's a great question. So, I think the first part is getting them to be more NEAT. Now, once they've bought into this concept, then we want to start putting them on some fitness programs. So in the bronze level program, I start talking about different exercises that you can start doing every day at home. You don't need a fancy gym, you don't need fancy equipment, you need a little bit of motivation. So things like, jumping jacks and push-ups, exercise like planks, squats, things that can start building full body strength. All you need is your body weight. And I have patients in my office in their 80s that are doing this kind of stuff, and I have kids as young as 8 and 9 doing this kind of stuff. Functional body weight training is really dependent upon your own body weight, so it works for anybody of any age. And I often hear people think, well, I'm too old, so I can't do this, or I'm too overweight, I can't do this. But I have patients in my office, and that I detail in the book, of all ages and with all different kinds of diseases and illnesses. And exercise is both a preventive medicine and it's also a treatment medicine. We have good data on a big study that was published in Harvard, came out about 3 weeks ago, that looked at exercise instead of medicine for treatment of many of the long-term diseases, cardiac diseases, diabetes, and found it to be equally effective with really no risk for anybody who takes it. So, getting yourself moving, as I mentioned before, is just the key to this book's message.
Yeah, and I think what's really appealing about this to a lot of folks is that it's simple, the simplicity, and I think everybody knows we can use more simplicity in our lives, whether it's exercise, whether it's our diet, or something like our finances. All right, that's Dr. Jordan Metzl. The new book is called The Exercise Cure, a doctor's no-pill prescription for better health and longer life. Thanks so much for being with us.
Sounds great. Thanks so much for having me.
And thank you for watching Newsmax Health on Newsmax TV.